Really, to treat small business properly, it had to be designed for small business, and what we've done is we've decoupled it, we've unbundled it. So we sell the account, then people can bundle on the amount that they need for their particular circumstances, and then insurance can be added on as well if a company wants that.
Why don't more, because this is not a well-known program, it's not a well-publicized program.
That's right.
Why don't more insurance companies make this available, and how do the insurance companies make money at it?
Well, that's the whole thing. They're making very, very significant amount of money off small business. When I was in small business, my premium, every dollar of premium dollar, 35 cents went to the insurance company and the broker in commissions, and only 65 cents went to pay benefit. So the question is, why would they bring out a new product? They're quite happy. There's a high penetration and of their product now. And so there's a big gap in terms of knowledge. And that's one of the reasons that I'm quite passionate about getting on shows like this, to let people know that there is a better alternative. Now, what we found in our research was that there was an appetite in small business for this, but it was hard to reach them. And so one of the things that we're doing in our marketing plan is we're reaching out to their health providers, and we're finding the uptake and the interest there is very great. Health providers, chiropractors, physiotherapists, opticians want to make health care more affordable and accessible for people. And we find that point of sale is the point where people have the pain. And so this is the point at which they can look at this and really see the benefits that the government has provided for them, but they haven't heard about.
How long's the program been around?
This would shock you. The government made provision for it in 1986. But the problem was only the big insurers had the administrative capability back then, and they were happy to bundle all this in with their insured products. Essentially, I worked as president of a company in the insurance business, and I recognized that really to treat small business properly, it had to be designed for small business.
Before you introduced this particular program, there was a program for employers called a Cost Plus program, where they could do something special for certain people within their company. Help us understand what that Cost Plus program was.
Well, the Cost Plus program meant that large insurance companies, such as Great West Life or Sun, who provided group health benefits for all employees, found that the executives and the managers were complaining because they had to dig into their pockets too often for these co-pays and deductibles. And so what they provided was that provided you had an insured benefit program for all employees, they would provide a Cost Plus, which meant that I could submit my cost, $300 for eyeglasses. They would charge 10%, $30 to administer it, and they would make it tax deductible for me as a manager. I don't really think that's fair.